Good morning, Tony Maritato here. So I wanted to answer a question that came in on the YouTube video comments for a video that I just shared today. This individual mentioned 3 things that I think are worth talking about and giving you guys a little more context. So this person said after the knee replacement, the leg felt heavy, the knee was stapled and tight, and the anesthesia took days to wear off. So let's talk about those 3 things. I know patients always talk about losing control of the leg following the knee replacement for the first few days. They have a hard time or they're incapable of flexing the hip, lifting the leg. This is mostly done when they're trying to get in and out of the car or going home or coming to physical therapy. And there's a couple reasons why something like that would happen. Whether the surgeon uses a tourniquet or not, if they use a tourniquet, there is going to be some muscle damage. Some paresthesia will happen that make it hard to control the muscle. One of the first things we work on in the clinic is hip flexion, being able to lift the leg up and down. I'll show you a video clip because I think as you wake that muscle back up, as you regain control of that muscle movement, everything else becomes a little easier. But the leg feels heavy because the muscle isn't functioning right, not really because of the swelling. The swelling will come, but it's not usually the first day or 2. The second part of the comment was the knee was stapled and it felt tight. So talk to your surgeon before you have your surgery. I know a lot of clients absolutely hate when a surgeon uses staples to close the incision. There's lots of closure methods. Staples are great. There's great research behind staples, but I think what happens is you see the staple, it looks gnarly, it looks ugly, and it starts to create this mindset that I find that my patients are fearful to bend their knee when there are staples. Even if they have the range of motion, there's something about seeing those staples in the skin that make them fearful to bend the knee. As soon as the staples come out, their knee bends great, but it's something about seeing the staples. So talk to your surgeon. If you think that you're uncomfortable with staples, see if there are other closure methods your surgeon would be comfortable using. And then the last one is the anesthesia took days to wear off. And once again, everybody's going to be affected by anesthesia differently. Some people, it makes you feel lethargic. It makes you feel nauseous. I have patients in the clinic 1 or 2 days after their knee replacement, and most of the time they're right on the edge of vomiting because the anesthesia just makes them feel horrible. So same thing, if you've ever had anesthesia before for any other condition, I would recommend you talk to your surgeon. You might already know you're sensitive to it, but give yourself that time. I would argue there's nothing that's that important during the first couple days after your surgery that absolutely positively needs to be done. Yes, it's important you get up. Yes, it's important you move around and you get comfortable weight bearing through the joint. The joint is strong, the joint is stable. But if you're dealing with other post-surgical complications like nausea, dizziness, lethargy, any of those things, you feel unbalanced, I would tell you that you probably need to take a little bit more time, give your body a chance to recover from the surgery, and then we can deal with possibly delayed rehabilitation after that.